Thank you so much. Okay, hi there. So I'm going to be conducting your medical examination today. Okay. So for your checkup, I do want to go over some things before we dive in. Have you had a medical examination recently? Okay. Okay. That's totally fine. Because it's been some time since you have had a medical exam, I'm going to be doing a very detailed exam on you. So I will be concentrating from the top of your head and to the bottom and just ensuring that everything is healthy. Okay. Okay, so I'll put the date here. And then I'll log it into the computer system, and you won't have to have another thorough examination for a while after this one. Okay. So I'm just looking over your blood tests. Okay, there was nothing of concern whatsoever. Your iron is a little bit low, so if you can take some supplements to help raise your levels, your iron, that's very helpful. Yeah, I can get you some capsules or just increasing your iron intake through diet. Okay. Okay. Everything is looking great otherwise. I see a note here that you've been experiencing some issues with your eyes. Okay. And is that your right eye or your left eye? Okay. Do you wear any contact lenses or any kind of glasses, reading glasses? Okay, none at all? Okay. Do any of your family members wear glasses? Okay. Okay. Perfect. Okay. Okay, so I'm just pulling up your file here on my computer, and I'm going to update it as we go. And how are you sleeping these days? Okay. Okay, thank you for letting me know. So I'm going to put on some gloves, and then I'm going to begin by thoroughly checking your scalp. Alright, so I'm going to be just checking your scalp, and I'm going to brush my hands through your hair, and I'm just going to be pressing as well on different areas. Do let me know if there is any kind of pain or discomfort, any sharp or dull pain, any numbness. itchiness, that sort of thing. Okay, good. Here on the side. Okay, just looking through your hair. Okay. Checking here. I'm just gonna press a little here. Okay. Okay, and just behind your ears here in the back. And on the top here. Everything's looking good. And how is it feeling? All normal? Is there any itchiness? Any kind of pain? All good? Yeah, visually speaking, you have a very healthy scalp, very healthy hair. Even distribution, follicles look good. Yeah, no bumps, no lesions, no inconsistencies that I can tell. Just going to thoroughly come in here, okay? Just want to come in on the side. Okay, just going to take a quick look at the back here. Sometimes behind the ears can be a bit tricky. Okay, just keep it nice and straight and still for me. Okay. Good. Just feeling along your ears, pinching a little bit, not too hard. Okay. Very good here. Good. I'm just gonna feel a little bit here on the top. Just get my hands through your hair. Okay, just gonna scratch on your scalp. Okay, very good. Hardly any dandruff at all. Very healthy, good stuff. Okay. Okay, just gonna come around here. Okay. Just going to come around here. Good. Just want to take a look. Feeling the top, the side here of your head. Beautiful. Okay. Just gonna tap here. Okay, just gonna come on this side. Brush my hands here. Just looking through your hair. Okay, very good. Beautiful, so far so good. Okay. Just gonna lift your hair here. Go through. Just lift here, go through. And press. Okay, good. Okay, I'm just gonna press a little hard the scalp, just the bone here. I just wanted to make sure it wasn't irritated at all. Yeah, it's totally fine, completely normal. Okay, overall looking good. And I'm just gonna come to back here. And you can just rest your head in my hands. Okay, good. Very good. Perfect. Okay. Well, everything looks completely normal. There's nothing of concern. You don't experience any headaches as of late. I see no lesions. I see no issues with hair or any kind of skin irritation, that kind of thing. It looks very healthy. Great. Well, let's continue on. I'm going to take a look at your eyes now, okay? So I have a pen light, and I'm going to be shining it on your eyes and just taking my time looking at your eyes and making sure everything is healthy neurologically and with your sight. So I'll be placing the light just around your eyes and on the pupil as well. So I'm going to test a couple of things, and if you can just keep your head nice and straight for me. Okay, good. Just a very dull light, nothing too crazy. Alright, so I'm just going to look here and see your eyes. And I'm checking here just for the color, okay? Very nice, milky white, good color. Nothing of concern. Okay. And I think because you're having some issues sleeping, that might be the reason for the mild redness that I'm seeing in the corners. Okay, just coming around here. Okay, good. And just looking at the color. Very good, very milky white, healthy, responsive to light. Okay, good. Okay, and I'm just going to ask you to keep your eyes on my nose or my forehead. Good. And try your best to keep your eyes there. Blink as you please. And I'm just going to check here from your peripheral. Okay. Good. Okay. Very good. Okay, good. Okay. Very easy job for you. Just look straight. Okay. Good. Perfect. Okay. Everything is reacting as it should. So that's a good start. Okay, I'm gonna come around on this side now. I'm just gonna cover this. Good. Just looking here. Okay. Okay, good. Just gonna come in on the side. very pleased with that. Have you been experiencing any kind of dizziness, any blurred vision, trouble reading? Sometimes when you're driving? Okay. I might have you go in for an eye exam at some point and just double check on your vision, okay? Because sometimes that can be from lack of sleep or stress, so it very well may just be that. Now this light is a lot brighter, so I'm not going to come very close to you, but I am going to ask you to tell me when you can no longer see it in your peripherals. Okay, so I'm going to ask you to keep looking at me. Okay, good. And the same thing, but let me know whenever it comes back into your field of vision. Okay, so whenever you see it, let me know. Very good. Okay, same thing. Let me know when it arrives in your field of vision. Alright, do the other side here. Okay, let me know whenever it exits your field of vision. And let me know whenever it comes back. Okay, very good. Your response is accurate. So how are we doing so far? Are you feeling okay? Everything's good? Okay. So I want to just take a quick look into your mouth. Okay, I'm going to use the brighter light. Can you go ahead and open up? Alright, thank you. Okay, let's see. Has there been any sensitivity with your gums? Any tooth pain? Any chipping of the tooth? Okay, everything is planted firmly. I see no decay. Overall good gum health. Okay, good. And if you can just try and relax your tongue a little bit. Thank you. Good, thank you. Now I can see your tonsils a little bit better now. Great. Healthy pink color. Good. Very good. Looks good. No swelling, no irritation, no redness. Everything's comfortable for you? Okay, good. Alright, just looking here. Okay. Perfect. I'm just going to press on the back of your tongue, okay? Good. And I'm going to tickle the back of your throat just a little. Perfect. Okay, that's great. Okay. So I have a new pair of gloves on now, and I'm going to be doing an examination on your arms, your neck, and your chest and shoulders, okay? This is just a simple tracing over the arms, tracing over the shoulders, and making sure that there's equal sensation on both sides. no lesions, no bumps, no bruises, nothing of concern, okay? So I'm going to be checking the temperature of your skin, the look of it, and all that fun medical jazz. Great. Okay, so can I please have your arm? Thank you. Okay, so I'm going to be feeling down your arm. I'm going to be lightly touching, and sometimes I'm going to be tapping. Let me know if there's anything of discomfort, irritation, anything like that. You get it. I'm just going to press here. Just along the collarbones. Press here. Okay. Good. Your shoulders. Just relax the arms. Okay, good. Then just turn your arm here. Good. You're warm to the touch. The skin is a good color. Everything is healthy. You can deserve to. Good. Okay. Just tapping here. Good. Okay, good. I'm just gonna bend the elbow, okay? Good. Good. Okay. This side. Just gonna bend. Okay, a little tap here. It's okay. Good. Okay. Very good. Very good. Alright, and I'm going to also feel your abdomen and along the ribs. Let me know if there's any pain, any discomfort. I'm going to just do some light taps on your torso as well, okay? Okay, just here. Okay. Okay, I'm just going to feel along your ribs. Can you breathe out for me? And out. Good. Okay. Take a deep breath in. And out. Good. Okay. Is there any pain at all in that? Okay, very well. Okay, I'm just going to feel your back. Okay, just feeling along your back. Anything uncomfortable at all? Okay. Okay, while I have you like this, I'm going to listen to your heart, and I'll be listening to your lungs, so you can just continue as you are. Okay, and just a deep breath in, listen from your back, okay? Okay, I'm just gonna hold your chest here. Good. Then you can go ahead and take a deep breath in for me. And out. Okay. Deep breath in for me. And out. Okay, just over here. Okay, deep breath in for me. And out. Deep breath in. And out. Good. Okay, and I'm just going to do a quick update here on your file. Okay, so everything is good with your heart, your lungs, sounds clear. Very happy with that. Everything so far has been completely normal. Okay. Okay, so I just made a quick note that other than mild redness in the eyes and some issues with sleep, there isn't anything of major concern. Everything is normal as far as your arms and your shoulders, your neck, your ribs and abdomen. Everything is completely healthy. Yeah, I'm very pleased with that. So let's move on to your ears, okay? Okay, so I do have my good friend here. He is a tuning fork. Let's call him Nigel. And he'll be singing a nice song, just a mild vibration, and I'm going to be placing that just on your right and left side, and then various areas of your head, just to check your hearing and make sure everything is working as it should. Okay, are you ready? Nigel's ready. And could you hear that okay? Could you hear him loud and clear? Okay, good. I'm going to do the same thing on the other side. Good. Okay. You heard that okay? Okay, I'm going to do the exact same thing, but this time I'm going to take away the tuning fork and just let me know whenever it is no longer audible, okay? Okay. Let's try that on the other side. Okay, I'm going to do the same thing, but this time I'm going to place this between your teeth. I'm not going to actually touch the teeth. I just want to make sure the sound resonates. Okay, so you can just slightly open your mouth. Thank you. sounded normal? Did you hear it on one side more than the other? Pretty much equal? Okay, and how are your legs and your feet doing? Are there any issues in the calves or in your hamstrings? I know you work a lot on your feet. Some soreness? Okay, I'm just going to take a look, if you don't mind. Okay, I'll just roll up the pant legs, okay? Okay. Okay, and just on this side, you can lift your leg up a bit. Okay, perfect. So I'm just going to feel along your calves, okay? Just here. Everything feels normal, just mild soreness. And how does this feel here on your leg? Okay. Just gonna press along your leg here. Yeah, your muscles seem very healthy. I think that you might want to look into orthotics. Yeah, just for your feet. Okay, and I'm just going to do a quick sensation test. Quick test down your legs with these very blunt objects, as you can tell. And I'm going to ask you to let me know if anything feels numb at all, okay? Any soreness, anything at all that is out of the ordinary. Okay, just from the top of your thighs down to your feet. Here you go. Okay, and here. You're okay? Okay, just here. Normal. Okay. Okay, I'm going to do the same thing with both of them. All seems normal. Okay. And just below for your feet. Okay. Okay. Yep, you can feel that okay, even through the sock. Okay, good. Just on your shins, okay? Okay. Everything's good. Wonderful. Okay, well, everything is responding as it should. I do want you to take your iron supplement, and I do think that vitamin C may be beneficial to you as well. Yeah, vitamin C is the kind of vitamin you can definitely be generous with. I also think it'd be wise to get your eyes tested, as I mentioned, just to find out if the redness and irritation from the eye is from straining or if it's simply from stress-related issues. Yeah. Otherwise, your scalp is looking completely normal and healthy. Your ears and your eyes overall responding quite well. Everything is quite normal. Your skin, your temperature, your breathing, everything is good. So I don't have any concerns. I will make sure to write you just a note on the iron. And obviously, if you have time in your day, just be mindful of how much device time you are having, okay? Just in case that's from issues with staring too much at the device. Very well. Okay, well, it was a pleasure seeing you, and I'll see you again next time. Take care of yourself.